Congratulations on your decision to obtain the benefits from walking. For most people with arthritis, and for people in general, a regular walking program is the easiest and safest way to get the needed cardiovascular exercise and all the wonderful physical and mental benefits it brings. The Arthritis Foundation Walk with Ease program has been developed with two paramount goals: safety and success. This program is designed for anyone who wants to increase physical activity to gain the benefits of exercise. Most people who can be on their feet for 10 minutes without increased pain will be able to participate successfully. Here's how the program works. Register for the program online, obtain the guidebook, listen to the audio recordings, and commit to walking at least 3 times a week for a 6-week period. One of the best things about walking is that it doesn't require much equipment that you don't already have. All you need are some comfortable shoes and a safe place to walk. Keep weather in mind. Consider indoor walking opportunities on days with extreme weather. You might also prefer to carry a water bottle or have one nearby. A step counter could be helpful, but it is not necessary. The goals of the Walk with Ease program are to help you: 1, understand the basics about arthritis and the relationship between arthritis, exercise, and pain. 2, learn how to exercise safely and comfortably. 3, use methods to make walking fun. And 4, make a doable personal walking plan with realistic goals for improved fitness. This program will help you gather tips, strategies, and resources that will help you stick with it, even when you don't feel like exercising or when things get in your way. It will also help you learn about other programs and resources that can help you keep up your walking and even branch out to other programs that other people with arthritis enjoy. The guidebook offers problem-solving strategies. For example, Chapter 1 includes 3 basic components to successful problem-solving. Chapter 4 includes strategies for overcoming common barriers to maintaining a walking program. Topics we cover in sessions are explained in more detail in your guidebook, along with other information that we won't have time to cover in the videos. So it's important that you read your guidebook. Self-directed Walk with Ease programs may vary in format, but regardless of the arrangement, you walk when and where you want, with a goal of walking 3 times a week for 6 weeks. Your local Walk with Ease leader can provide short videos and audio recordings if you are interested. The videos and audio recordings are to help educate and keep you motivated to move. There are guidelines for how much physical activity people with arthritis should do. The Center for Disease Control and Prevention Arthritis Program urges people with arthritis to work towards getting at least 30 minutes of moderate physical activity 5 times a week. This is equal to about 2.5 hours a week. This activity can be accumulated in 10-minute intervals. The Walk with Ease program is designed for people at all levels of walking ability. So if you're not ready to walk as much as 30 minutes right now, that's okay. You can start slowly and build up to 30 minutes. Most people living with arthritis experience joint pain, inflammation, stiffness, and limited mobility. Even so, many can walk for exercise. However, if you have any concerns about your health and capacity to be in the Walk with Ease program, you should ask yourself whether you have any of these health problems. Do you have heart trouble? Do you have chest pains or pain on your left side, like your neck, shoulder, or arm? Or breathlessness when you are physically active? Do you often feel faint or have dizzy spells? Do you have high blood pressure? Do you have bone or joint problems that could worsen if you are physically active? Are you age 50 and have not been physically active? Answering no to all these questions gives a general indication that a person can participate in a physical activity program. However, If you think you'd answer yes to any of these questions, or if you were uncertain, we recommend that you check with your health care provider before you begin this walking program or other forms of exercise. Because this is an activity program that may challenge you a bit physically, to keep everyone safe, I'd like to review a few warning signs that we all need to watch for. If you or any of your walking partners develop severe pain, pressure, tightness, or pain in the chest, nausea, difficulty breathing, dizziness, severe trembling, or lightheadedness, stop immediately and call 911. These are signs of potentially serious medical problems. If you find you or a walking partner are getting a stitch in your side, very red in the face, or very pale, sweating a lot, extreme tiredness, or after you get home, you find that your pain 2 hours after you started stretching and walking is more than it was before you started walking, then you are pushing yourself too hard. Next time, go a little easier. In order to exercise safely, avoiding pain and injury, it's important that you always start with a warm-up. Walking slowly for 3 to 5 minutes. Then stretch slowly and gently for 4 to 5 minutes. Remember, no bouncing or holding your breath while stretching. Hold each stretch for 30 seconds. After stretching, complete your walk. The cool down is similar to the warm-up, walking slowly for a few minutes. Then end with a final stretch session. The stretches are pictured in the back of your guidebook. Chapter 1 includes a starting point self-test tool that will help you determine how common problems associated with arthritis, such as pain, fatigue, and physical limitations, may be affecting you. The tool can help you learn about your starting point for the beginning of this program, and your score can guide you in choosing which parts of the book and the Walk with Ease program will be particularly important to you. The starting point self-test includes scoring instructions. Your self-test score is strictly for your use. No one will ask you to share your score unless you want to. It may be the first time you've completed a self-test like this, so if you need help completing the form, please feel free to ask. You can also use the test again after the end of the 6 weeks of the program to see whether there have been any improvements in the way you are managing your arthritis. I encourage you to read chapters 1 and 2. Remember to take that starting point self-test to help with determining how to begin. Whether you are using your walking time to think deeply, not think at all, or to connect with a loved one, enjoy your time and stay safe.